early for us, but we have
Yeah.
Sarah Vaine from the Summit County Community Care Clinic joining us. A very, very busy woman, I must say. So we're happy to have you on this morning.
I'm happy to be here. Thanks
Yeah,
for having me back.
Talking all about what you guys have at the Community Care Clinic. And for people that don't know, you really kind of cover all facets of healthcare, and you do something called integrated healthcare. So can you describe
Correct.
what that is?
Absolutely. So this is one of the pieces that we're most proud of in terms of the services we do at the clinic. So when a patient comes in for whatever their complaint might be, let's say they come in for a sore throat at the care clinic, they meet with their provider and they're evaluated for all their needs at that time. So they're asked questions about mood, they're asked questions about alcohol and other drug use, tobacco use, and if they answer affirmatively to those questions, then services are offered very frequently that same day at that same time.
Okay.
They're offered those services. Similarly, we do oral health care for our patients. So I did have a couple examples of patients and how they've come in and what the outcome was.
Some success stories, if you will.
Absolutely, yeah. So we had a gentleman come in. He worked as a carpenter in the carpentry business, and his business had lost quite a bit of business. He was down in his income. And so he came into the clinic to get his teeth cleaned. And during that time, the dental assistants, as they do with every patient, asked questions about mood and substance use. And he was in a place that he could answer honestly and said, I've actually been very depressed. I've been drinking a lot more since my income has gone down. I'm feeling really concerned about my future and just not good about myself. So then we do what's called a warm referral, where they push a little button and a therapist is paged. And so the therapist went in with him and met with him regarding the depression and the alcohol use. And he was set up that day with some counseling services. And they talked to him about his primary care needs. He also was eligible for a colonoscopy through the Colorado cancer screening program. And so he was able to get a colonoscopy. Polyps were actually found. And through that program, he basically had treatment for the elimination of those polyps and treatment for any precancer concerns that he had. So he came in for a dental cleaning.
So this happened in one day.
It did.
That's
so
crazy.
He didn't get the colonoscopy in one day and the primary care visit, but all of that was hooked up in the one day. And he did meet with a therapist in that one day, and we set him up with appointments for the other things that he needed. So the neat thing is you don't typically go into your dentist and
talk to a
offer those
therapist.
kinds of services. Exactly. So another example is a woman who came in. She was 45, and she had strep throat. And during the visit, it was found that she had really high blood pressure. She also hadn't had an annual well women exam for over 5 years. So they did a annual exam that day when she came in for a sore throat, and the results of that came back precancerous, and so then she was enrolled in our Women's Wellness Connection program through the state of Colorado and received additional screening and treatment for those cancerous cells, and all of this was due to an appointment for a sore throat.
And all of it is because you guys go the extra mile and really check up on every facet of the people that come in.
So the goal of our clinic, we're not burdened by the same fee-for-service payment schedule that primary care providers are, because our funding is grant funded and state funded and donations, and so we really try to take care of all the needs in that one visit. I mean, our goal is if you could come in one visit and get everything taken care of instead of coming back for a different appointment every single time. And I really believe that if people who are ill can't afford health care and they don't get the health care that they need, then all of the community ends up paying for that. Their illnesses increase and they go to the emergency department and they can't pay those bills and default on those. And that's when all of our insurance premiums go up. So providing care to people who don't have it and preventing serious illnesses is really in the best interest of the whole community and the taxpayers.
Yeah, and I know you and I have talked about how this community is very unique in the fact that we have a lot of seasonal workers, and sometimes, health insurance is not a top priority for maybe the 20-something demographic. Which I think preventative care often gets swept under the rug because you wait for an emergency to happen, and at that point, you could be looking at, a lot more money than you were anticipating.
And then, so that is true, especially people in the service industry. I said last week with Ashley that 65% of the jobs in Summit County are lower paying service industry jobs. That's a huge proportion of the jobs in Summit County. But there are older people too, parents and families. my age, not older, I hope, who, you know, are choosing to get some kind of coverage for their children and then foregoing insurance for themselves because they can't afford it. And so that's also a big proportion of our patients.
Yeah, and I think the message is you can't compromise on your health when it comes to that. You really have to take the steps to do what you can to protect yourself.
Exactly, and so that's why we're there. If you're not sure whether you're eligible or not, please come in and find out, because our income levels are higher than people believe. So there's lots of people who think it's the free clinic for people who have no income, and that's really not true. So I would encourage people to come in and have us evaluate your financial situation to see if you're eligible.
Yeah. And if you don't know where the Care Clinic is, they're right in the Frisco Medical Building. They've got a big sign out outside their office. And now I think that most people in the community that haven't heard of the Community Care Clinic will be able to talk to other people who have definitely used it and found that its benefits are beyond immeasurable. So Sarah, great to have you on this morning.
Thanks
for joining us. So we're going to take a quick break here on Summit Sunrise. When we're going to come back, we've got lots more to talk about, including events going on in Breckenridge and Frisco for the rest of the summer. So make sure you stay tuned.